Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
The dopamine hypothesis of schizophrenia postulates an abnormality in which of the following dopamine pathways as the etiology of symptoms. Select all that apply. So this is a slightly different question form. And it does happen on your boards. It's certainly not the majority of questions, it's a minority, but there is the occasional alternate format question, select all that apply. So you know when the question says select all that apply, at least two of the answer choices will be correct. All right, so the dopamine hypothesis of schizophrenia. Hopefully you are familiar with it. I'm sure you learned about it in school. This will definitely make an appearance on your boards. It always does. It's really one of the strongest physiologic theories when it comes to psychiatry. And so the dopamine hypothesis postulates an abnormality in which of the following pathway or pathways as the etiology of symptoms. Okay, so this is clearly a physiology question. You know that there are 4 dopamine pathways and they are all listed for you right here. We have to select the 2 that are believed to be the etiology of symptoms. So we have the mesolimbic pathway, the mesocortical pathway, the nigrostriatal pathway, and the tuberoinfundibular pathway. Remember, these dopamine pathways all basically have their point of origin in the substantia nigra of the brain, a subcortical anatomical location where many dopamine pathways originate, and then they branch off to the various terminations. The mesolimbic pathway, of course, the limbic system is essentially the terminus of that, whereas the mesocortical pathway begins in the substantia nigra and distributes in various areas of the prefrontal cortex. The nigrostriatal pathway has its origin in the substantia nigra and heads toward the striatum, the area that controls movement, your pyramidal tracts, your extrapyramidal tracts. And the tuberoinfundibular pathway, remember, it starts like all the others in the substantia nigra and has its terminus in the posterior pituitary. And that's your prolactin pathway. And so, which 2 are the 2 that are believed to be the origin of etiology of symptoms? That's the question. And the answers are choices A and B, the mesolimbic pathway and the mesocortical pathway. Again, all 4 answer choices represent the 4 dopamine pathways that are part of the conversation about schizophrenia, but the 2 that are implicit in the etiology of symptoms are the mesolimbic and the mesocortical. In schizophrenia, the dopamine theory, and not everyone ascribes to this, but it is the prevailing theory, the dopamine theory postulates that there is an excess of dopamine binding of D2 receptors in the mesolimbic pathway and a deficiency of dopamine binding in the mesocortical pathway. This is what results in the positive or psychotic and the negative or depressive symptoms, respectively. In other words, the patient with schizophrenia is believed to have too much dopamine activity in the mesolimbic pathway, which produces the psychotic symptoms, the hallucinations and or delusions and or disorganization. And a deficiency of dopamine activity in the mesocortical pathway is believed to result in the difficulty with executive function, the difficulty with that normal articulation between cognition and emotional expression. It's that flat, loss of higher order thinking is the deficiency of dopamine in the mesocortical pathway. And those are the 2 problems. In schizophrenia, the remaining 2 pathways are unaffected. They are within normal limits. The reason that we even talk about those pathways is that when we medicate schizophrenia, when we try to interfere with dopamine activity in the mesolimbic pathway, we do. And psychosis and hallucinations, they're easy to control. The problem is most medications that suppress dopamine activity in the mesolimbic pathway unintentionally suppress dopamine activity in the mesocortical pathway, making the situation even worse, making the patient more flat, they struggle more with executive function, etc., less emotional expression. And it also suppresses dopamine activity in those two pathways that were like fine. Now you've got decreased dopamine activity in the nigrostriatal pathway, the end result of which might be extrapyramidal symptoms like, dystonia or even tardive dyskinesia, the involuntary movements of extremities or the facial muscles, and the decreased dopamine activity resulting from pharmacotherapy in the tuberoinfundibular pathway interferes with prolactin control and expression. And so you get the gynecomastia in males, you get the abnormal menses or disrupted menses and problems with fertility in women. And so the real takeaway, and I know I'm perseverating a bit here because it is important and it is definitely something that you will see embedded in a test question or two, is that the dopamine hypothesis of schizophrenia postulates that in the patient with schizophrenia, the symptoms are a consequence of too much dopamine activity in the mesolimbic pathway and too little dopamine activity in the mesocortical pathway. The other two are fine. But when we medicate to suppress dopamine activity in the mesolimbic pathway, we control the psychoses, but we also inadvertently depress dopamine activity in the other three pathways, making the negative symptoms worse and creating symptoms in the other two pathways that weren't there before. And that's why we keep seeing, like every time you turn around, somebody's putting a new antidepressant medication or antipsychotic medication on the market. It's not because the old ones don't work. It's just that the adverse effects are so disruptive that people don't want to take them. All the newer evolutions of antipsychotics are designed to try to continue to suppress dopamine activity in the mesolimbic pathway while simultaneously having little or no impact in the others, and in a perfect world, even improving it in the mesocortical pathway. Nobody's done it yet. News to follow on that. But that's the story of the dopamine hypothesis of schizophrenia.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.